We are going to jump into a conversation titled Caring in Crisis, Supporting Immigrant Families. So across the country, we have really felt this fear and uncertainty around immigration policy and enforcement. It's created real barriers for healthcare access for many families. For immigrant parents, even just a routine pediatric visit can be fraught with anxieties about being seen, being heard, about being safe. And today's panel is really going to explore how we as healthcare providers, as advocates, as community-based organizations can really meet these families with compassion, understanding, and some practical supports. So we'll be able to hear from experts on finding community through this, how to build trust in that clinical environment that might otherwise feel threatening under certain conditions. This conversation is certainly timely, and it is essential to the care that we want to provide for every young child that comes through our doors. As a reminder, we will have time at the end for a Q&A, so please feel free to put your questions in the chat or in the Q&A box, and we will be monitoring that through this conversation. And I'm delighted to pass it off to our moderator, Karen Rogel, who is the Director of Strategic Initiatives at Literacy, Inc. Thank you, Karen, and we look forward to you guiding us through this discussion.
Good afternoon, everybody. I want to say how grateful I am to be here today, and I would like to thank Reach Out and Read for making this a topic for this panel discussion. My name is Karen Rogel. I'm Director of Strategic Initiatives at Literacy, Inc., LINC, also who is the lead facilitator for City's First Readers, CFR, which is an initiative made up of 17 early childhood literacy organizations, Reach Out and Read being one of them. And we are just happy to be part of this. Through my work at LINC and CFR, I've seen how essential it is to create environments where immigrant families feel safe and supported. And I'm so very excited to be leading this panel. So today I'm joined by 4 incredible panelists who bring different lenses to this kind of work, from clinical settings to community-based partnerships, and all with literacy initiatives. So I'll let them introduce themselves, and we'll start with Dr. Alan Shapiro.
Hi, everybody. Thanks so much for inviting me today. I really want to thank Reach Out and Read and Jessica Lizio for helping set up this incredible panel and this really important conference. I'm a pediatrician. I am an assistant professor of pediatrics at the Montefiore Medical Center and Albert Einstein School of Medicine. I am the senior medical director for the Bronx Health Collective, which is a community health center, a federally qualified community health center affiliated with Montefiore Medical Center. And I'm also the founder and medical director of Terra Firma, which is a wraparound service program tailored for the complex needs of unaccompanied migrant children and families. We have nonprofit legal services integrated into our primary care setting. And our medical and mental health providers who care for the children and families that come into our practice also develop or conduct assessments and write affidavits that are used as evidence in immigration court that strengthen their cases and improve the outcome. And also, I'd just like to say our frontline work over the last decade has really, I think, made us better advocates. And we know more than ever that our families need, we need to help our families and children advocate for their rights. So thank you so much for inviting me.
Thank you for being here. I'll pass it on to Dr. Qadeer.
Everyone, I'm Dr. Ricky Qadeer. I'm a family physician and medical director at Bronx Health Collective. I work with Alan, Dr. Shapiro. I've been here for the last 8 years. The last year or so, I've been the medical director for 2 of our sites, including for our home program, which is for stands for Unhoused Mobile Outreach and Mobile Engagement. It supports care, medical care, and support for families who are living in shelters throughout New York City. Really excited to be part of this panel and bringing the perspective of a Bronx-based physician, as well as a Bangladeshi immigrant. I grew up in Queens, have spent most of my life in New York City. I've been a lifelong fan of reading, whether it's the New York Public Library, and then Reach Out and Read has been a big proponent for that since I started at BHC. And also love sharing that love of reading with my 2 kids. I have a 3 3-year-old and a 6-month-old, third generation immigrants. And so those are all the kind of things I bring here. I'm really excited to be part of this panel.
Thank you for being here. And I will pass it on to Andre Eaton.
Thanks, Karen. And first of all, let me say happy anniversary to Reach Out and Read. For the past 25 years, you've been doing outstanding work. Glad to once again be a part of your conference this year. Once again, I'm Andre Eaton. I'm the New York State Director for ParentChild Plus. And our overall mission is really to reach families in historically marginalized and underserved communities with early education, school readiness opportunities, but we do so much more. We engage early in life, working with young children, their parents, and their family or home-based childcare providers to give them an access and a path to possibilities. Overall, we've reached over 9,000 families annually. We're basically we are a nationally and internationally organization too as well. We're in 16 states, 6 countries, 145 local partner agencies, including school districts, community-based organizations, social service agencies, and community health centers as well. And just as an intro to our panel as well, 69% of the participating parents that we work with are born outside of the United States, and 66% actually speak languages other than English too as well. But we'll sort of get into more of that a little bit later on in the panel. Glad to be a part. Our methodology is really home visiting, so we really go into the homes of the families with our one-on-one model with 92 home visits, and we provide 46 books, which are gifts to families. And we'll talk about that a little bit later. So thank you for having me, and I look forward to the discussion.
Thank you, Andre. And I'll pass it on to Dr. Hart.
Hi, everyone. So congratulations, Reach Out and Read, for 25 years. I'm definitely excited to be here today. I'm Dr. Krupa Hart. I am the Director of Pediatrics here at Urban Health Plan. We are based out of the South Bronx, where I actually was born and raised. I lead the pediatrics department at our main site, serving children from newborns to 12-year-olds. We care for the underserved high-risk population, and throughout many years at Urban Health Plan, we have been deeply committed to developing and implementing supporting tools that help protect and empower families. At our clinic, we strive to ensure every family feels welcome, safe, and supported. Today, I'm honored to be joined by the panelists of passionate medical professionals from diverse backgrounds. Each of them bring a unique perspective to the work of supporting immigrant families throughout our clinical care, community-based partnerships, and of course, our literacy programs that we build trust and resilience with. I'm looking forward to a meaningful discussion, and I'm so glad I am here today. Thank you.
Thank you, Dr. Hart. Okay, now that we heard from all the panelists and a little bit of their background, let's get into some topics and some questions. At first, let's start seeing what does being on the ground in terms of family feel and disengagement mean. So first question, what trends are you seeing in your clinic or program in terms of immigrant families withdrawing, hesitating, or delaying the care? I'll start with Dr. Shapiro.
Okay, thank you so much, Karen. You know, I wanted to approach the issue maybe a little more broadly. We were talking a little bit about this amongst the panelists, and I just want to sort of set up a few concepts for the audience. The way I like to look at caring for newly arrived migrant children or families or immigrant communities is to think of it in the big picture. Like, what are rights that all human beings should have? So I think about the Universal Declaration of Human Rights and the Convention on the Right of the Child, which provides really important practices and guidelines for the humane treatment of refugees, asylum seekers, including children and families. And you know, the US was very instrumental in developing these guidelines, and they signed the guidelines, yet they have not ratified the guidelines, which, you know, maybe puts us at a legal disadvantage in some ways. Although most countries around the world, except very few, have not signed on or have not ratified these set of human rights. So I'd just like to start with that to put it into perspective of who we are and how we approach this issue. I also think we want to think about like different models of care. And one of the models is the best interest of the child. So what do we do to make sure that that children are treated humanely and safely? And there's very set of guidelines for that that are written out in those guidelines that I've just mentioned. And then I like to go also to the toxic stress model. Like if we don't treat children and mitigate children's stress at a very young age, but really at any time, we can see the consequences of that stress build up over time. And that can lead to growth and development problems, learning problems, how to manage stress in the future, and actually chronic illnesses. So I think it's really important for us to start with some of these baselines first when we think about addressing the needs, the very complex needs of migrant children. I also want to remind us, this is round two for us, right? This is round two of the Trump administration. We know that they've had the last 4 or 5 years to develop their Project 2025. Sorry, my phone keeps going off. I will silence it really quickly. I just also want to say that we also had time to prepare. And I think we learned a lot over the last administration and worked really hard to develop our own advocacy platforms and activities to mitigate the stress that our families see, but also what we ourselves as providers see. So I just remind you all that in the first wave of the first Trump administration, we dealt with issues that were very serious, like prolonged detention of children and families, remain in Mexico policy, and maybe most egregiously, childhood or family separation. And now our new wave of executive orders are really affecting us, especially here in the sanctuary state like New York, or a sanctuary city like New York. So we're seeing expanded incarceration again, the opening of family detention centers. And interestingly, many of the families that are being detained are actually not apprehended at the border, but apprehended internally, like a family upstate New York. So it's affecting us very acutely, not only at the border, but within the whole country. And I think that's important for us to be aware of. Also, sanctuary cities are getting sanctioned or with cuts, punished with funding cuts. And that's going to affect us greatly. God forbid they cut Medicaid like they're planning to cut Medicaid. That's going to affect all of us so much because Medicaid is the biggest source of funding for the states. And that worries me how that's going to affect Child Health Plus, which then provides health care insurance for undocumented children. I will also say that what affects us all very directly is the loss of sensitive location status. So health centers, schools, churches, courts in the past were deemed sensitive locations that ICE agents, Immigration and Customs Enforcement agents could not go to and apprehend or arrest people that they thought needed to be or were on their list to be arrested. But right now, the executive order of the Trump administration said that those sensitive locations are rescinded, no more. So we as health centers have to prepare for caring for what happens when an ICE agent comes to our door. And so I will direct you to the National Immigrant Law Center, NILC, N-I-L-C. If you go to their website, they have very clear guidelines for health centers. I will also say that the New York Immigration Coalition has great guidelines as well, not only for your patients, but for your staff as well. So just think of, you can go to that. And I could put some of that in the chat, Karen, if that would be helpful for folks. And then lastly, I just want to think about what is happening now in this country is another form of family separation. So mass deportation of adult men and women are leading to family separation. And we've already heard of about 7 children that have been deported with their parents, 7 US born children that have had to leave the country because their parents were being deported. So it was either family separation or deportation. But we know from the past that detention of adult members of families leads to family separation, leads to more poverty, leads to homelessness, leads to lack of access to healthcare services. And that brings me to maybe my last important point, which is the chilling effect that all of these rules have, and that the current rhetoric of the administration has, which is that people are afraid to go to sites like their healthcare centers or to hospitals. And so they put off healthcare, and that puts them all at great risk. We know that during the pandemic, immunization rates went down really low because people weren't able to leave their house. The same types of things will happen, or children won't get seen, or adults won't get seen at their health center for primary preventive care, and will end up in hospitals sometimes too late. And that these are things that really worry us. So things that you can do to reverse some of this is to really prepare your patients. We give out red cards, and I'll put know your right like cards that we give out to all of our patients. So what a family, what a person can do if immigration or customs enforcement stops them in the street or comes to their house. We're also conducting Know Your Rights campaigns with our legal partners at the health center, so that families can be prepared for knowing what to do when ICE comes to their door. We are having trainings for our staff about what to do when ICE comes to the health center. And lastly, and this is the most painful thing for me to say, is we are conducting family preparedness presentations for our families. We're using Lutheran Immigrant Services for that. And this is really what a family needs to do, it's like emergency preparedness. If an ICE agent removes the parents, who are those children going to be with? And I mean, it is hard for me as a pediatrician to talk about this because it's just unfathomable to me, the inhumanity of it. But these are things that we can do. So the motto really that everyone is saying is don't panic, be prepared. And so I will leave you with that. Don't panic, be prepared. And we could talk more about strategies to get prepared. And there's lots of resources out there, including the American Academy of Pediatrics, which has a ton of resources. And I'll put all of this in the chat now. Thank you so much, Karen.
Thank you, Dr. Shapiro, and thank you for the context behind everything that most of us are doing. But let's hear from some other panelists. Dr. Qadeer, any trends that you are seeing in your clinic?
Yeah, I mean, and so Alan covered a lot of the similar things that I'm seeing because we work side by side. I will just add one piece of what I've observed on my own as well, and then pass it along to the other panelists. I think, so BHC, Bronx Health Collective, we're a federally qualified health center, and FQHC. And so what comes with that status is we are a clinic that is open to the community, regardless of their insurance status, immigration status, like we see everyone, right? Like that was the case before this administration, that's the case now, and that's going to continue to be the case. And I think by the community knowing that, and we're housed directly like in the community as well, right? We're next to the bodegas, the subway, housing. And so like we're a known quantity in the community, and that has built a level of trust even in like really difficult times. And there are definitely patients that we've heard of who have said that they delayed their appointment or didn't want to come in because they were worried, or they heard there was like an ICE agent at like the bus stop or a train stop. And sometimes that has been true, like as we've seen in the news, and other times it's just been kind of hearsay, right? And it still has the same effect, the chilling effect that Dr. Shapiro mentioned. And but I think us being able to be a trusted community partner with families and with patients really helps kind of break through, especially even just them sharing their fears and having a safe place to do that. And then along with having these different these different resources, whether it's the red card or access to the trainings, I think can go a long way. So I just wanted to kind of add that as well, just from my personal perspective.
Thank you, Dr. Qadeer. And then we'll hear from Dr. Hart, and then we'll go into community programs and how they are seeing this.
So just adding more on to Dr. Shapiro, Urban Health Plan is at FQHC as well. So we definitely have a diverse population. What we have tried to do is to just build trust and ensure that families feel very safe, because fear is actually preventing families from coming and seeking medical care, especially children, which really need primary care services. So we definitely have trained staff, we've trained managers, we've done a protocol drafted just to make sure we know what to do in these situations. If ISIS was to arrive, we also offer Know Your Rights flyers. We have a lot of resources. If families need support with social worker or case management, we're able to make sure they have, and we can support and address them on site. Just recently, I just want to give this little synopsis. This week, we had a family of 4 who's been seeing our provider for several years. And the fear is actually, she disclosed that she is deporting herself. She's taking herself and her children and she's going back to Mexico because of the fear and the unknown of what is not happening. And so that's just the severity of where we're at today. And I just feel as long as we can provide a safe space and trust, we can at least impact parents, especially single moms, in a different way in helping to provide primary care services.
Thank you. And next we could hear from Andre. How has this trends that you've been seeing affect community programs?
Sure, I think it's been stated by all the physicians and doctors too as well, particularly, and thank you, Dr. Shapiro, for really bringing the humanity of this to the forefront, because I think we kind of missed it, because we always talk about immigrants without realizing that these are human beings too as well. These are mothers, these are fathers, these are grandparents, these are primary caregivers in our communities too as well. I sometimes can't separate my MSW hat from my MDiv hat, because we're all children of God and should be serving them too as well. What has been mentioned, clearly there is a lot of fear that's out there. The fear is has been exacerbated for many of our community partners. Thank God for community partners who are in the community, who work in many of the in more impoverished communities around New York City. We're in every borough except for Staten Island, but we're in those particular communities. I'm a product of Bushwick. I live in Bushwick too as well, Bushwick, Brooklyn as well. But we're seeing immediate needs that need to be met. And this happened too, as was indicated in the first administration, with food, clothing, shelter, meeting their immediate needs, while we're also providing literacy services to the families. So we want to put these overall wraparound services around the families, but those needs have begun to increase. For many of our programs, we have not seen a decrease, and that's because they're able to trust our early learning specialists, which are our home visitors. Building those positive relationships goes a long way. If they can trust you, if they can work with you, if they understand what you're bringing to them, particularly us, since we're going into their most safe space, which is inside their home on a weekly basis, that means that they have to maintain trust. They have to believe in you. They have to believe in the program and the services that they're receiving. So our first step really is what we call a no matter what approach. That's number one, maintaining trust while trying to keep them as safe as possible, protect them as much as possible from trauma, secure the primary bound between the child and the primary caregiver, be it a mother, father, grandparent, or even a family home-based child care provider. Also meeting the diversified needs, understanding that we work with a diverse cultural and linguistic community across the board. And so when we come, we bring the materials in the native language so that they can understand, they can comprehend and relate it that way, culturally and also linguistically, for them to also get the resources as necessary. The second issue that we're also facing too as well is also working with our own staff. Staff has fears, and now they have to walk around with their name tags on and their identifications on as they go into these communities because ICE is profiling them too as well. So we have to combat all those particular issues, and our organization has been working on that from administration one, also during the pandemic. So let's not also forget the pandemic. We had some of these issues, so we kind of had a playbook. It's just gotten more advanced in 2.0 now that we're seeing that ICE is going at a much more advanced level, really attacking families directly, going to homes and so forth, but really trying to exacerbate the trauma that these families are going through is something that we can consistently do. And we have to be consistent. That's another key. You have to be consistent in bringing the resources and be there. So for me, it's 5 principles: being safe, being trustworthy, bringing peer support, collaboration like we're doing today with Reach Out and Read and other programs that we network with, building the empowerment of the families, hearing what the families need, what their fears are, taking their testimonies, their issues, and being aware of that, and then being humble in our responses to them, really responding in an efficient way, in a fast way as possibly can, particularly around meeting their immediate needs in these cases.
Thank you. Some of you already started answering the second question, which is like, how is your organization, your clinic, your program directly addressing these challenges? And some of you have great programs. Is there anything somebody else would like to add to this? I know you did start talking about it. Any program specifically? Okay. I also could talk about City's First Readers. We also started as soon as the administration put out some orders out there, we started effectively creating a CFR United for Families. It's a committee where we had a lot of the partner organization and was open to everyone to come to this platform to be able to share stories. So it became a platform not just for sharing resources that we can directly share with our families. It started becoming a platform where we can lean on each other and support each other. It is very difficult for the providers, the workers who do work with the families to live in this kind of chaos and not understanding how to support their families. Through this committee, we were able to provide, I guess, caregiver workshop series where we were doing developmental workshop series that included know your rights workshops. We did a lot of trauma and immigration workshops, and we did trauma and development workshop for the families. We were able to come up with a statement on our website to say that we together will always stand with our families. Like Andre said, developing trust is very, very important. And then through this committee, we also did something called the CFR safety kits. In these kits, we delivered them to all 17 partners, about 25 to 50, depending what each partner did. And in these safety kits, we had copies of Know Your Rights cards. We had copies of the actual warrants that they had to look out, how to speak to your child, QR codes of storytelling of immigration stories for parents to talk to your children and share with their children. So those are the things that we were able to do directly. And some of the partners were able to give these safety kits out during their programs, during tabling, during events. And some partners asked for more, and some partners were okay with what they gave. And there was also like links so that they can continue printing on their own. So I'll pass this on to see if Andre, if there's anything else that you would like to say your organization did directly to support this cause.
Well, first of all, we're a part of the City's First Readers
Yes.
Initiative too as well. And so I think we can start there. And thank you, Karen, for bringing all that out too, as well as what the initiative is doing too as well. To just go on the full overview of what ParentChild Plus does. First of all, we build one-on-one relationships and we a one-on-one model of care. And so we reach families exactly where they are, providing 92 weekly home visits to them over a 46-week period, giving them 46 books in their native languages. And so that's kind of the hook of how we draw them and actually bring them into our particular program overall. And we have the receipts. I like to say that that 50% of the families that actually participate with us are more likely to be prepared and are school ready as they enter kindergarten. They score 2 times higher on the social, emotional, and development, because as we know, literacy is just not learning how to read. It's also social and emotional development, which you also give to the families too as well. They're 3 times more likely to be, less likely to be referred to special education in those particular needs too as well. And we have a 30% higher graduation rate as they progress through their years too as well. But it's about building trust. It's about supporting the adult-child interaction. We do that in our one-on-one model, and we also do it in our home-based childcare model too as well. Next slide. I think there's another slide behind this, if I'm not mistaken. No, that's true. But this is the way that we actually engage and meet with the families. But while we're visiting with them, we're able to assess what their other needs, as I mentioned before, are. So if it's the immediate needs of food, clothing, shelter, the programs that we work with will also allow them to put the wraparound services around those particular families and meet them where we are. Let me also give this other third component too. We also hire from and within the community too as well. So we try to do a cultural and linguistic match, as I mentioned before. So not only providing a book or a book in their hands that meet their language and culture, but also a home visitor, which is the early learning specialist, that is also a culturally matched to as well, to meet their needs and to get a full understanding of what they're going through as they navigate these particular times. But the collaboration and the coordination is something that we will continue to do and consistently build upon with Cities First Readers, other Reads initiatives. This is not a time to be siloed. It is a time of connection. It's a time of collaboration. It's a time of building strong continuums with other resources that families can trust, because we know they're not going to stay with us forever, but they will move on to that next step. We want to make sure that that next step will also keep them safe. It's an organization that's trustworthy, transparent, and also give them the support that they need inside their own communities.
Thank you, Andre. And leading us, a good segue into our next question is, how does access to books and relational help matter more now than ever? How do the books support your emotional safety and relational connection for the new immigrant families? And we'll start with Dr. Hart. You're on mute.
So we here at Urban Health Plan, especially the pediatric department, are very big on parent-child bonding, strengthening those relationships, especially between reading, right? So when we first, we've had ROR for 20 plus years already. And so we've just been able to expand out, and what we here feel is very important for just not only families, but the community that we serve, because we are located in the South Bronx. So building trust in a safe environment by demonstrating clear communication and reinforcing those privacy protections. That means assuring families that their immigration status is not collected or shared in accordance with our HIPAA and clinical policies. Like I said previously before, we make sure that we do continuous training with staff and managers, as well as departmental, to make sure that we have the tools to provide to families. Provider conversations during well-child visits is imperative. So providers, we normalize fears, we use a trauma-improved approach, and we screen for social determinants of health. During anticipatory guidance within the visit, providers invite the discussion about stress or fear, asking families what are they worried about, what are they challenged with. We train staff, like I previously said, especially on signs of trauma, because that can present itself whether it's at registration or whether it's at the prepping with the MA involved prior to the provider even going in the room. We also use tools like Prepare and WeCare, and that helps us to identify any related services that they might need legally, or any housing, safety concerns, as well as food or nutrition. So for us here at Urban Health Plan, we do a continuum of service, which we identify what is needed. And before the patient will leave the primary care visit, we make sure they have the appropriate needed resources. For example, if a patient of ours deems necessary for food, we have the ability to come down and bring food packages, so that we know that going home, and with being able to have that nutritional value, but also linked to services outside of just the primary care services. We collaborate with legal and social services, so we partner with local immigration advocacy groups or legal aid. We host community events or legal clinics. We offer the Know Your Rights flyer to refer patients so that they feel like they can trust the agency, and then partner with organizations to provide those type of sessions so that we can address those concerns in real time. We integrate immigration themes into Reach Out and Read programs, and that's by selecting books that depict immigrant families, resilience, and multicultural stories. We use book-giving moments to foster connection. In our lobbies, we have little towers. The premise usually with those towers are take a book, leave a book. Our premises, take the book. Right, so we have separate donations that we use for the towers that are located in our lobbies and in the pediatrics department, just so that we really foster books. Some books, for examples, that we use, especially with immigrant families, is Dreamers by Y.E. Morales, right? Because that depicts a whole immigration story, and it helps us to build trust between the family. Mama's Nightingale is another one, which just depicts like how how a mother is detained, right? And that experience, because most and for all for Urban Health Plan, and especially pediatrics, we want to make sure we can relate. This story is about a family moving to a new country. Many families we see have been through similar experiences, and so reading about that is extremely important for us. And then empowering parents and advocacy. Handouts with parent and child friendly language provide materials that explain civic rights in multiple language. So we definitely encourage storytelling. We create a clinic bulletin board or booklets created by local immigrant families, fostering community and visibility. Here at Urban Health Plan, we pride ourselves on making sure you feel safe, you trust your provider, because I can't emphasize the trust word more. The more they trust, the more they will seek help. When they don't trust, they won't seek help. And we have to make sure we can tackle what families really need, because it's, for us, it's not just about the child. And we can make sure that mom or dad or extended family is good, then we know the child will be good.
Thank you so
Thank
much,
you.
Dr. Hart. That is very important, as you mentioned. I'd like to continue with the same question to Dr. Qadeer. How has books support emotional safety or relational connection for new immigrant families in your clinic and practice?
Yeah, so I'll focus with our families in our shelter specifically, because I think that is kind of like an atypical setting for many families to receive like healthcare. And yeah, there's one of our vans, I think one of our older versions. And so this is like a completely like mobile clinic. There is somebody who greets the families at the front when they come in, helps them like sign up for insurance and things like that, checks them in. We have a nurse who does our vitals, and then they see the medical provider. And we have our driver as well with us, and that forms a core team for these mobile units. And they usually are like parked in front of shelters or in shelter parking lots. And there have been several that we've gone to for some for decades and others for like many, many years. And so what I think is helpful about these settings are we're seeing families. So some are definitely recently arrived immigrant families, and some are immigrant families who have lived in New York for decades. And let's say they were living in Brooklyn, they lost their housing, and now they're in Queens, or now they're in the Bronx in a shelter for the first. And for some of them, it's like the first time they've ever navigated another part of the city. And there are families we have from out of state, sometimes from like natural disasters. I just saw a family from North Carolina that came up after one of the hurricanes, a few months back. And so we kind of see a wide diaspora of immigrant communities at our mobile unit sites in our various shelter settings. And I think what's really nice about this kind of setting, you have to often think outside the box. You have to do you have to do more with a little bit less, right? Because we have a smaller team, and at the same time, it does build intimacy. People really get to know that unit, that group of people, that staff that is there, and we're usually at our sites on like a weekly basis, so they know when to find us, when to come see us. And for many people, they've had like negative experiences with the healthcare system, and having like an atypical clinical setting is a plus for them. In our exam rooms, we have books like just right next to like our computers lined up, and sometimes kids are curious and they'll pick it up, and it really gives an opportunity right then and there while we're in the exam room to have these conversations with kids, with the families, and it's one of my favorite things to do. And I think particularly being able to build trust with a lot of our families who are in kind of like some of their worst parts of their lives. They've lost jobs, or they've lost their housing, they were evicted, various traumas for both the kids and their parents. It is nice for us to be able to do what we can to build connections with them. And oftentimes we see that even after they leave the shelter, which is more often than not, luckily, we still continue to see those families after they leave and they're in permanent housing. They still will see us at our fixed shelter, or our fixed clinic sites in the Bronx. And so it's really nice to be able to kind of continue that relationship with the kids and with the families. And what else do we want to say? Yeah, and I think the Part with that this slide mentioned with the ICE protocols, it is also can be challenging in this climate. But like I had mentioned before, I think one of the nice things about having like an atypical setting is that we're like right next to the shelter, right? Or we're in front of the shelter, and they don't have to go far to see us at many of the sites. And so that kind of helps that, okay, I just have to go out and walk a few feet versus like going out and taking the train or taking the subway. And I think, of course, that helps just with the trust of being able to receive care in a safe way.
Thank you so much. And that is an amazing support you can provide for the community. And I do agree it is very important to know the setting you're in and what rights you have, and to inform your staff and to inform the families and to speak about it. Even with City's First Readers, every setting we had an event, and that was one of my first questions. What is your protocol? Who will take the lead if any of these things happen? Okay, same question, Dr. Shapiro. How have books provided support, like emotional safety and relational connection for the families you serve?
Yeah, I think when all the others answered it, I think very much the way I would have answered it. I think the kind of the point I'd like to make is that it's, I think people come into your health center expecting certain things, and when you go above and beyond what they're expecting, I think it shows a lot of it shows that you're really thinking about their needs and what they're looking for, and that it brings in another dimension of the medical home that we're really trying to create for families. And I think the medical home model, where we're not only healthcare providers, but we're advocates for the families, it helps really bolster that concept. And so I think, I'm sure Dr. Hart knows this. I know Dr. Ricky knows this, but we have no bookstores in the Bronx. I think we had one bookstore that closed in the Bronx, the entire Bronx. We have no bookstore. I am like a bookstore junkie. So like for me, it's just unbelievable. We do actually have some very decent libraries. So I do want to point that out. And one of the ways that we have really, I think, built on the Reach Out and Read program is to develop a very strong relationship with our local libraries. And we have libraries that the library staff come into the health center, register everyone for library cards, read to the children in the waiting room. And I think that is sort of a nice way of building on the Reach Out and Read principles. And it's like, what are your resources in the community? And so you can only give out so many books, because we're giving them out at every single visit. We have bilingual books. We are seeing more and more French speakers from West Africa. So we have to think about also bringing, in a wider range of languages, of bilingual language books, but we do have the access to the library. And I think that's a way we can do that. One of the other things that we're doing is we're working with the International Center at Catholic Charities, and we run English language classes. For many years they were on site, and now we're doing them virtually. And they're really well attended, and we are just beginning 3 levels now. We had 2 levels. We started with 1 level, we went to 2 levels. So now we have beginner, intermediate, and advanced. And I think that really just brings the concepts of reading and language together. And I think it shows our families that we really care about them. We really want them to be successful. And we're kind of approaching that issue in all different ways. And so I think that's really what I would add to the conversation, the very rich conversation we just had.
Yes, thank you so much. I do agree, in crisis times, a lot of organizations, clinic programs do bond together. I'm very proud of us as New Yorkers for prepping ourselves, our families. Your rights, what do you know? So we're better prepared than to be caught off guard. And I think we have time to ask the one final question is, think of, in one sentence, what is one action that your clinic or your practice or you as a provider can take tomorrow to better support families through relational care and shared reading?
Karen, one sentence might be too hard with that one. So I think it's what we said, but I think most importantly, it's about being consistently aware and knowing what resources that are out there to share with the families. I think it's also continuing, as been said, the word trust will linger on even beyond this particular panel. They have to be able to trust you because word of mouth will get out too as well in our communities too as well. They will come to you if they trust you. And so be aware, be trusting, open up opportunities for them to discuss their particular issues, and be consistent in your resources and your support.
Thank you. I agree. Would somebody else like to share, like what's a best practice that you can leave, that you can provide for immigrant families?
I think continuous training, right? As we continuously train staff, whether they're new or old, we make sure it stays on the forefront so that families feel welcome and safe. And then ensure that we are not just talking the talk per se, but we're actually walking it, right? Because sometimes we can get in a situation where we're saying it, but we're forgetting to do it. And you'll be surprised how patients pick up on that. And so just making sure that we ensure to them that this is a safe environment, that you're in a trusting relationship with your provider, because if you trust your provider, you're more than likely to seek services and also continue those services, which I feel in today's environment, it's crucial.
Thank you. Very important. Dr. Qadeer.
I would add just listen. Like I mean, just like really listen. Just really briefly, what first thing that came to mind as you're asking the question was during COVID, we did a lot of presentations around the vaccine to various communities, various patient groups, and we gave the same presentation to different types of patient communities and groups, but there were concerns were different from each one, right? And like for one that came to mind was some of our immigrant communities, like the young women or the parents of the young women, were really worried about fertility, right? And so when you really listen and hear their concerns, are they against the vaccine or are they worried about something happening for their kid or for themselves, like their ability to have children in the future, right? And so when you get to the root cause of that and you understand why they're concerned, that helps you validate and connect to like, listen, I hear you, and this is like kind of why this is how we can have this discussion in a way that like both honors what your concerns are and also get to like the heart of the medicine and the evidence behind the vaccine, just like as an example.
Thank you. Very good. Dr. Shapiro?
Yeah, I was trying to think something to add to what my amazing panelists have already contributed. I think I like the idea of consistency. When kids come into our clinic, they run right for the book closet. Like they don't even they don't stop, right? They won't leave without going to the book closet. So I love that is so part of like the culture of the health center now. I think just the other thing I would add maybe is, people are under so much stress. People are under stress in the best of times. And I think in the worst of times, it's just that much more heightened. And I think for me, reading has always been the biggest escape. It's always sort of like been my like lifesaver. And so I talk about that a lot with families and kids and hey, just take a couple of moments for yourself and enjoy your child and be with your child and be present and be just enjoy the story that you're reading together and just kind of like go out of the world that you're in. And I really just like that way of thinking about reading, and not making it so much like an exercise or a chore or homework, but it's like actually something you're doing for yourself. So I like to think of it in that way.
Thank you. I also agree with all of everything you guys said. We don't realize the power we have, and how much families and providers do trust us. So because we are such trusted providers, I think we do need to do our due diligence to vet services that come our way. How good are they for the families before we put them out there? Because we do need to build trust. And I think doctors are the first like families that they trust, and then you will send us to the providers. So it is important to vet all the information, all the resources you have, what's valuable, what's good for them, how are they being treated. It is very important. And for us to understand cultural norms. Even in the Latin culture, every country has different norms, that what comes first, what comes next, how do they see it? So it's important to be aware of all those norms and how we can provide information. So even with Cities First Readers, we have 17 partners. And yes, we are all early childhood literacy organizations, but each of us have a different little take on it. So I think we're at a 10-minute mark. I don't know if there's any questions from the audience, Carrie?
I do, yes. Feel free to keep putting those questions in the Q&A or the chat. We have 10 minutes here to address some of them. And also I'll ask if you have any resources that are related to the topics that this panel has discussed. Dr. Shapiro has put a bunch in the chat. We'll be sure to put these in our follow-up emails as well. But if you have resources that have really, really resonated and supported the work that you're doing, please share them in the chat as well, and we'll be able to learn from them also. Question that I have here is specifically about the training. I believe Dr. Shapiro and Dr. Hart, you talked a little bit about training, and I know there's other training that happens with ParentChild Plus as well. But how do you think about training providers, especially whether you have residents, new staff that are coming, on really how to talk with families who are coming in, who are experiencing fear related to immigration and security? And are there any specific resources?
I'm going to answer very briefly, but I'm going to turn it over to Dr. Qadeer, who is really our trainer at our at Bronx Health Collective. But we do a lot of grand rounds, a lot of resident presentations about the work that we do with newly arrived migrant children and families, and I think that is and trying to write articles that help really increase knowledge, professional knowledge of the issue. I also would recommend the audience. There's the council, the American Academy of Pediatrics has a council of immigrant child and family health. It's really fantastic. If you get on the listserv, you will be getting constant information about issues on like the best practices in immigrant health and immigrant child health, and also advocacy activities. So I'll put the link in again into the chat, but I highly recommend looking at or joining that council. I'll turn it over to Dr. Qadeer because he does a lot of training at our site.
Thanks, Dr. Shapiro. Yeah, I mean, I think one thing we didn't talk about early on was that our clinic is part of the Montefiore Einstein system. And so we have a lot of learners that come through our sites, both medical students and residents, pediatric residents, family medicine residents in particular. And I think there are many residents who are mission driven, who are interested in the work that we are doing, and they end up rotating with us. And it gives us an opportunity to just model. I think that's like the first step, just like modeling. And so they pick up some of that, and how we're talking to our families. We give them like some also specific didactics. For first year students, I teach at the school as part of like a course on health equity, immigrant health, just like a very basic introduction to immigrant health. But immigrants are not a monolith, right? Like we have many different communities, even within the Bronx, even within subsections of the Bronx, for example, or different parts of the city. And so I think we try to teach that kind of understanding who the communities are that you're going to be serving, whether it's now, whether it's in the future, and what are the things that are important to them when they show up to see you, whether it's in the clinic or in the hospital, before a surgery. So yeah, I think you harnessing that interest that students and residents have and new learners have, and then reflecting that back to them in the work that we're doing has helped kind of then build like another generation of students and residents who are going to continue this work.
Hi, here at Urban Health Plan, like Dr. Shapiro said, that we have ground rounds. We also have a robust residency program, and we try to make sure that we do what we call as a town hall, where we get all the organizations. Because we're such a large site, we have approximately 12 facilities. We try to make sure that we use that as another form to make sure organizationally we're all on the same page. We have definitely created protocols, but I think what really drives the driving source is we ensure that the managers who are doing like the operational responsibilities are key, right? Because they're going to make sure whatever family, whatever the concern is, we're going to be able to address the family before the family leaves. And I think that is very important. So just we pride ourselves on quality improvement, quality assurance, and just making sure we constantly are training and keeping it on the forefront, because we never know what to expect.
And for ParentChild Plus, I will say too, we do a lot of training, so it would be too much to go into in the details. But because we have two models of how we do our home visits, as I mentioned, primarily was with the one-on-one, and now we do a home-based childcare model where we're actually trying to build that particular workforce. We're constantly and are committed to evolving and developing our both curriculums over a period of time. Along with now we have what we call the communities of practice, so folks can actually get together, talk about what's actually going on in the field. So, and we like to see from the theoretical into the practical, exactly what's being used, what is useful, and we're constantly changing and tweaking and doing those things too as well. I will say though, getting back to racial equity, over the past 5 years, we have renewed our commitment to race equity, re-examining our organizational structure, training, curriculum materials, programming, and exploring how we can do this work both nationally and also internationally too as well. And also building a book list that is also culturally and linguistically diverse, not only by the book itself, but also by the authors, because we fit such a unique space. We serve families with children from 16 months to age 4, or right before they go to preschool. They get 46 books, which are free, which are their library right before they go to school. But we want our families and children to understand that they're all also authors from their same culture, that speak their same language, and can also share their stories too as well. But it's constantly evolving, and you can reach out to us at ParentChildPlus.org, and we can talk a little bit more about what we embed in our curriculum. But it's just a lot of elite detail, but we do a training ongoing.
Thank you so much, all. Got time for one more quick question. And thank you everyone in the chat that's putting resources and some of your own thoughts. One of the comments kind of sparked this question. We are talking really about some stressful, high stakes challenges today in this panel specifically. And I'm wondering if you have any insight on how we as caregivers and as community members can really keep being that support and trusted resource, while also caring about our own selves, ensuring we have that strength to carry on with all the stress and kind of responsibility that I think a lot of people are feeling in this moment.
I just wanted to say real quickly, I think you just have to enjoy, like we can hold both carry this heaviness and also just enjoy ourselves, like go Knicks, for example. Like I just have to throw that out there. And I think also our patients appreciate that too. Like when you're able to share those kinds of experiences and things like that, whether it's a movie you just watched. I was just talking about Sinners with a patient yesterday. And so I think that stuff like outside the heaviness, I think is really helpful.
I think, I grew up and my dad would say it takes a village to raise a child, right? So it takes all of us. It takes all of our networking, all of our resources to just make sure that we stay current and that we're able to provide the best possible service we can. And I know just personally for me, it is so gratifying to see, providers when they have a visit, the provider will start off the book, open the book and start off the book. And the kids are so excited for that book. And then it also ensures that we are strengthening the bond, not only between parent and child, but also provider, parent, and child.
I would say hold space for each other, to be able to behold, so that we can be ready and whole to help the families that we are serving. Because it's hard. It affects us all personally, professionally, everything that's happening.
I would say definitely take care of you. You you have to continue to work on you and find those spaces to celebrate. Celebrate when you can, even in these challenging times. We also celebrate with the families. So we do graduations and ceremonies, and know that you're still making a difference, even though they're going through all these particular situations and circumstances that they may see. If you're a faith-based person like myself, use your faith too as well. Whatever you can grab to take care of yourself as you work with the families and children that you work with in our communities, continue to do so. And again, like Reach Out and Read, ParentChild Plus, the doctors that are here in this great panel, continue to build those connections that you need so that you can be supportive of one another.
You all. Karen, do you have any last words to close out our panel?
Just thank you for having me. Thank you for putting this panel together. Thank you to all the panelists for your great insights on everything, and continue being there for each other.
Thank you. And I'll thank you, Karen, for your leadership here, and for LINC's and CFR's leadership in hosting some of these conversations. And thank everyone in the chat for messaging of support, of resources, et cetera, and Reach Out and Read. We're here. We're going to continue to have these conversations and continue to offer what we can to support all clinicians.